Welcome back to day 4 of the USET Best Practices Conference. My name is Rebecca Narragon. I'm the Economic Development Director here at USET. This session will be presented by Bryan Maracle, going over the title session called Building Better Data. Bryan is a Mohawk from Tinanaga, and I apologize if I pronounced that wrong, Bryan. Correct me if I misspoke. But he grew up in Akwesasne, New York. He has been living and working with Indigenous communities his entire career. With 20 years of project management experience in Alaska, he has developed an in-depth knowledge of using Indigenous values to deliver successful projects for tribal governments and enterprises. Whether it is creating traditional land use plans, climate change research, government to government negotiations, building better business systems, or telecommunications infrastructure, he works with organizations to achieve the vision they have on their terms. Welcome, Bryan. And also, just as a reminder, all sessions during the Best Practices Conference are being recorded and will be available for viewing up to 3 months following the conference using the links in your agenda and calendar invites. And conference materials will be available from this session from Bryan, the presenter, and other presenters. So with that, Bryan, thank you for your panel or for your discussion this morning. And thank you everyone for your participation during the Best Practices Conference.
Awesome. Thank you, Rebecca. So little correction, it's Tyndanaga, but that's totally fine. I get corrected quite a bit from butchering like Igiagik or Egigik or any of the Inupiaq or Athabascan names, so it's totally okay. We do our best. Sego Skanagoga, what's a Nunio Guego Guago, is a Karonhiakta'tie. I said hello and good morning. I'm glad to be here with you today. I hope the great piece is with you. My name is Karonhiakta'tie. I'm a Mohawk from Tyndanaga. Grew up in Akwesasne and have been living and working for the most part in Alaska for the last, I guess, 21 years now. And spending a lot of time with tribes throughout Alaska, doing a variety of different projects from telecommunications to climate change research. I'm really hoping to turn this session into much more of a interactive conversation about data, about what we know, what we don't know, and building towards a data model. And so what I'm going to do kind of in this session is we'll kind of pick a topic and we'll from your guys' experience pick a topic, and we're going to build out a data model associated with what do we want to know about that topic, and how do we do that? How do we do that in an effective way to kind of start answering questions? And we'll go around the room and get a brief introduction and see where folks' experience lie, and then we'll talk about where we can start building this conversation about how to build better data and what impact does that have on either the projects I want to do or the projects I need to do. And so yeah, I'll leave it there, and we'll start with Thelma.
Oh, hi again. My name is Thelma Sela. I am the Senior Director for Health and Human Services for the Seminole Tribe of Florida. And I was telling the group early on that I'm based out of Hollywood, Florida, but we've got several reservations here in Florida, as far north as the Tampa area. And I've actually been in this role for not too long. This is now going into my 5th month in this position.
Awesome. Welcome, Thelma.
Thank you.
Sonia?
Good Good morning, everyone. I have a weird background up on. I work in public health. I do consulting with state, tribal, territorial health departments. And I'm interested in the data piece because when we're working on performance measures or trying to improve quality, a lot of the times when we're trying to make something better in public health, it's hard to figure out what we're measuring. So we want to serve more people, we want to improve, but improve what and by how much? And that's often hard. So I'm always looking for new strategies for thinking about that. So thank you for the presentation today.
Awesome. Great. Great. Nikki, how about you? Hi, Nikki. You're on mute.
Morning.
Good
My name is
morning.
Nikki, and I'm the Grant Services Specialist for the Mississippi Band Choctaw Indians. And we're located here kind of central Mississippi. We're the only federally recognized tribe in the state. And really what I wanted to gain from this is I don't think we've done an assessment in a really long time. So I would really like to see how we can establish more data-driven strategies in terms of programs and departments and initiatives that we end up pursuing.
Awesome. Awesome. Thank you, Nikki. Kelly.
Good morning. Thank you for the presentation. I'm a Cherokee Nation citizen, but I've been working mostly internationally for the last 20 years, doing everything from surveys in communities, focus groups, other qualitative stuff, and secondary data analysis. And that's easy to do yourself when you've been trained in it, but now I'm trying to make a transition to working with tribal communities here in the US and to help equip them to collect their own data so that they're not researched on. I would like to, better train them to do their own research. And so I'm just looking for examples and tools that other people are using in tribal communities. So I'm eager to listen and learn more.
Yeah, well, you'll be a great contributor to this. Awesome. Thank you. Heather. Looks like. Oh, Heather's from, it looks like Seneca. And you can come off mute, Heather, if you would like to do an introduction verbally. And she worked for Seneca and been there about 9 months. It says, I support health systems programs and their grant reporting and program evaluation. Always looking for more about data collection and evaluation. Great. Well, thanks for coming, Heather. We look forward to working with you. S. Whitaker. You're on mute. I don't know if S. Whitaker. Emily, you want to jump in on a quick introduction?
Yeah, hi. Sorry for the big coat. It's Maine here. It's freezing. Yeah, I'm one of the staff epidemiologists at USET. So I'm one of the newer staff members, actually. I joined in April. And I'm just one of the projects I support is TechV, so our Tribal Epidemiology Center Public Health Infrastructure Grant, which is all about data improvement. And we're working on like an opioid mortality data improvement project right now. So I'm kind of just here to learn how I can support that more.
Awesome. Awesome. Well, thanks everybody for coming. I don't know if folks are familiar with mind mapping, and if you are, then great. If you're not, then welcome to the world of mind mapping. Where mind mapping is a tool, really a visualization tool, in order to brainstorm and start kind of expanding what questions are we starting to ask, and how are we asking them. Sorry, I'm clicking admit, folks. And so I'm going to share my screen, and we're going to look at a blank mind map and have a discussion on what I would like to do here is kind of throw it out to the group on, let's think about a problem that might exist in Indian country, that we need to solve with data, and how we might build a data model to answer that question. So that could be the use of telemedicine, that could be broadband connectivity, that could be economic development strategies in the agricultural industry or manufacturing. So I want to throw it out there is there an area or particular interest, maybe it is that you have or would like to discuss, and we'll start building a data model based on that. So we have any ideas on where to start? I mean, I could pick something, but I want to kind of engage you guys. So that means you all have to come out off mute.
Will you ask the question one more time about the kind of idea that you're thinking about?
It could be anything. It could be a public health. It could be anything really. It could be broadband, could be economic development related. Any idea, any new idea.
And this is something we're looking for, like that we would want more data on. Is that what you're asking?
Yes.
So just my thought would be like if this is what you're looking for, like the population of people using illicit drugs or something, any type of illicit drug on the reservation or something like that.
Okay. Okay. Any other thoughts, ideas? I'm gonna say, because I'll say number of people with broadband. We could say telehealth, adoption rates. Like, what are the rates that we're actually adopting? What are the barriers to telehealth adoption? Any other thoughts, ideas on something we explore a data model for?
Maybe like ventilation filtration systems in tribal buildings.
Sorry, I'm a firm believer that spelling was genetic and I didn't get that gene. So please correct my spelling when you see it. Other ideas? Could be anything. Could be public health, economic development. Do folks like the ones we've got so far? You have a favorite?
Yeah, I like the use of the illicit drugs on the reservation because that one, I think meth has really exploded here in terms of not necessarily just its presence, but really, arrests and the impact within the families. And I've even had that own conversation with my friends and family in terms of like, I had no idea how big it was. So I like that topic.
Okay. Good. Anybody else? You have a favorite topic? We want to run with the use of drugs on the res or illicit drugs, and what we might do to kind of measure that from a direct or indirect perspective? Okay. I think we might have a topic. Silence is agreement. All right. So let's go with building a data model around drugs, illicit use of illicit drugs on the reservation. So really the goal here is to say, what data metrics do I need to measure the use of illicit drugs on the reservation, and how might I go about achieving that data or getting that data either directly or indirectly, and what that might look like. So we kind of put a few things up here, and let's talk a little bit about the types of drugs we might want to measure. Meth. I put opioids on here. What other drugs do we want to kind of include in our measure of illicit drugs? Do we want to put heroin? What others? Do we want to stick on is it very hard drugs? Is marijuana in this group? Is it out of this group? Where do we draw the line for illicit drugs? Is it pure being illegal? Or is it kind of addictive nature?
So I was the one that proposed it. For our data purposes, we would use marijuana because it's illegal in South Carolina. And also just based on other calls, I would include it because even though it may not be illegal in all states, I think it still is usually a problem because it's used in conjunction with other drugs a lot of times, is what I've heard.
I would agree with that, Brian. Go ahead and add it.
And I would add also that meth, heroin, marijuana definitely are in the top of our area. So
okay. Any other, and do we want to put kind of a catch-all for designer for those bathtub type drugs beyond meth, right? Whether or not that's ecstasy or I don't know. I don't know what the new the designer drugs are these days. Any others? What other drugs do we want to measure or be in the kind of our target group? Yeah.
Do we want to include another catch-all for like prescription drugs that are used illicitly?
Yep. Excellent. Excellent. That is very good. So we kind of have a subcomponent there, right? So we have actual prescribed, right? We have two, and what I'm trying to think of how to word this. You have illicit use of something that is prescribed to, whether or not somebody's been prescribed Vicodin and they're overusing it, or if they're not prescribed that Vicodin and they're buying it on the black market, or so prescribed to. How do we want to describe that use of prescription drugs but haven't been prescribed to the individual? What terminology we want to use there?
Maybe prescribed misuse of your own and illicit use. I don't know if those are good categories.
Yeah, what list?
Because you can misuse your own, but then you can get stuff that has not been prescribed to you.
Yeah.
You want to categorize those separately.
Stuff from others. And we can, well, this is the whole point of
Diverted.
Are you back? Can you hear me?
Yes.
Okay. I lost my headset. That's okay. So we have get stuff from others, prescribed to if prescription drugs, designer drugs, marijuana, heroin, opioids, methamphetamines. Do we want to include other types of drugs in this mix? So we've kind of drawn our line.
Hey, Brian, in the chat, we had some other options, including diverted drugs and non-medical use. I think that, Emily, was that related to the breakdown of prescriptions?
Yeah, that was just another term for it.
Diverted?
Yes.
I think that's to replace get stuff from others, maybe, or add on to it. Yeah.
Brian, would it be possible to make the mapping section bigger so we can see? Perfect. Thank you.
Cool. So I'm gonna remove these for ease. All right. So our boundary is really whether or not it's something is illegal or not illegal in a particular area. Okay, so this begs a little bit of a question as far as if our boundary is illegal in a region or state, how do we potentially measure something that falls within a boundary of illegal in one state but not in another? As an example, marijuana is legal in the state of Alaska for recreational use. So how do we deal with that in or outside problem? What's a potential way to ensure we're not skewing our data? Do we make a boundary around the state or the region? What might be impact on that? How many folks live in states where where marijuana is currently legal?
I live in Kansas. We're one of 4 states that doesn't have it legal for medical or recreational.
Okay, so that's actually so illegal in the region state. So we have another breakdown, right? So we have medical legal and recreational legal. And we have all illegal, right? And this is particularly around marijuana, right?
There are also tribal ordinances. So where with the boundary illegal in a region or state, there's also tribal ordinances within a particular boundary communities.
Yes, that's excellent. State and regional boundaries, good. Okay. So any other kind of particular drugs to measure or topics that might impact the particular data? I know that one of the kind of new medical treatments that's kind of growing is the use of psychedelics for post-traumatic stress or kind of historical trauma. Do we want to put hallucinogens in the mix here?
Sure, why not?
Okay.
I've seen ketamine clinic ads on billboards in Tulsa.
That's not how you spell it, but I'll put how. We'll use that for hallucinogen. Because I'm a bad speller. So we have hallucinogens, prescriptions, designer drugs, which marijuana, heroin, opioids, and methamphetamines. So let's call it good there. And what do we potentially want to know? Do we want to know number of people use? Do we want to know number of people impacted? What's our question around our questions around illicit drug use? What do we want to know? Do we want to make it an economic angle, public health angle? What might we want to look at?
Can it be multiple things?
Absolutely.
Or we're looking at
Yeah.
one thing.
No.
I guess I would say like who's using. So like maybe if we're looking at like an age group, what age group? I don't know the question, but like looking at the age group.
Yep.
And then I know with us, what we're looking to get more data on is like who's like overdosing. I don't know what the best way to put that. Like, and then we're also looking at like overdose related deaths.
And I put demographics here, is we can kind of look at demographics in a couple of different ways. We can look at it from a ethnicity standpoint, a racial standpoint, a gender standpoint, an age group standpoint. So there's lots of ways to, let's say age, ethnicity, and what's a potential other demographic, income. What other do let's say who is overdosing? And who is using? What other potential questions do we want to answer? Where are we trying to solve the problem?
Jessica wrote in the chat function gender.
Yeah. So for that's for here and okay, that's good. What other kind of data points might we need or want?
I'm not sure what the larger topic or theme would be, but I'm thinking like age of first use or maybe introduction to whatever that particular drug is. That's
Actually timing. Age of first use, right? That's a good one. Length of use. That's good. And does length of use have, we can start kind of thinking about, does the time of introduction have an impact on length of use, right? If they were introduced very early, do they tend to use longer, or vice versa? What other particular answers might we be looking for associated with illicit drug use?
I was thinking of incarceration rates, and also co-occurring mental health disorders or co-occurring disorders.
Mental health. And could we say mental health being connected to who's using? Or would we call that a its own standing kind of standing item? Mental health because mental health is a good one. It kind of cross cuts a lot of these topic areas, right? So let's we'll kind of leave that standing here, because I think we're going to come back to that. Area. For incarceration rates, what do we want to, or what impact might incarceration rates have? Like, how is that a factor? Or how could that be a factor? Do we want to know if, like, the number of incarcerated people that use illicit drugs, are they more likely or less likely to use or not use? What about incarceration rates will bring us back to illicit drug use?
I guess what we usually look at is like how many of those tribal members that are incarcerated have a substance use disorder.
Yep.
Is my thought on that.
Good. Use. At least, hang on one sec.
Maybe initial cause of arrest.
You're on mute, Bryan.
Bye.
Yep.
Back.
I'm thinking about things also like impact on families, family violence, loss of income, stigma on families, but then also the law enforcement piece of it. How much does illicit drug use, how much of a burden is that to law enforcement, to courts, et cetera?
Mm-hmm. So how so judicial burden, and that might be its own, like, really its own thing, right? Because it really is very regional in the sense of what is the judicial burden on, like, as an example, like West Virginia has a much higher rate of opioid use than Connecticut, right? So the judicial burden is significantly more there. So that's a good question. So I think for the time we've got, we can cap there, because I think we could easily keep going on the answers we might look at. So let's explore this impact on families and expand that a little bit. What additional kind of metrics might be there for impacts on families? What would we want? What additional components would we want to measure?
I would think perhaps domestic violence, child abuse, loss of income, either because of a lot of money is being spent on the drugs and or the person isn't, able to work because of the addiction.
SB.
Also, it's really stigmatizing to families. They're hesitant to reach out to relatives or even services at times.
How would we capture that? Like as far as a
Maybe hesitancy to seek help or assistance, or service access hesitancy, or I don't know, something like that.
Hesitancy to seek services.
Sure.
Okay.
Maybe use of, maybe just their use of other services.
Yeah.
Because if they haven't, if they're hesitant, they're probably not involved in anything else in terms of therapy or social service or parenting or.
Yeah.
Or on the other side, they are, right? They're really someone that is really seeking other services. Do they see that? Do we see that pendulum swing where we don't see any or we see a lot, right? So, that's that use of other services, I think, is a great secondary metric that we might measure across.
Divorce rate?
Divorce rate as that is a great secondary metric as well, right? As far as when we lead back to, do we see high divorce rate birth compared to, is our correlation to amount of use or impact of use and divorce rates. So yeah, great kind of secondary metric. Awesome. So let's talk a little bit about mental health and judicial burden, because we've got no areas how we might measure here. Let's take mental health first. For mental health, what might be the metrics we want to measure around mental health as associated with drug use or illicit drug use? How would we go about measuring mental health attributes? Let's see. Whether or not they're in or out of treatment.
I guess we could say diagnosed or undiagnosed as well.
Yep. What about judicial burden? How would we go about kind of setting some metrics associated with judicial burden? We talked a little about incarceration rates. Can we place incarceration rates under judicial burden and say, is that what other components would be incarceration rates? Would be arrest rates, right?
Also, like first responders, kind of, because police officers, especially in like rural places, are the people administering to an overdose.
Yep. first responders. Call out rate. Right. So we have arrest rates, first responder call out rates, incarceration rates. This is good. Good first start. We'll kind of keep growing this because I think in particular with illicit drug use, there's lots of primary and secondary metrics that we might use. So what, kind of going down this route, let's look at primary metrics. So if we're looking at a primary metric for illicit drug use, what would we classify as being a primary metric? Right, obviously, the use rate, right? Rate, really, say ratio. I would say that is a user per 100,000 people in target area. So per 1,000 people, how many users do we have within a particular geographical region? And the geographical region is really kind of an arbitrary boundary. It could be the reservation, could be the state, could be northeast, southeast, west. So what other primary metrics do we want to look at, or would we want to look at? We have our use ratio. What other areas? Other primary metrics. And primary metrics being the primary metric. The specific leading back to this is kind of our measurable component leading to our answer or question that we want to answer. So if we have use ratio, we have what others?
Would drug of choice be one?
Say that again.
Would drug of choice be one?
Ah, good. Drug of choice. And that would lead us back to this is our drug of choice regional in nature, right? Good. Any others? Can we say income level? Is income level a primary or a secondary metric? would folks call income level a primary or a secondary metric?
I mean, I would kind of say it was secondary because I think with common with a lot of other communities that the people that we're seeing using, like, we definitely know they're below the federal poverty guidelines, or the federal poverty level. So I don't think like we want to see it, but it's not like the primary thing that we'd be looking at.
Excellent. Yep, that's great. That's right on the money. So kind of starting to dive down the rabbit hole a little bit here. If we know that we want to know what our use ratio are, we want to know what the drug of choice are as far as measuring those. Let's kind of narrow down our answers to 2 to 3. What 3 questions do we want to kind of focus our data collection around? And maybe that's data that we already have or data that we need to get. What 3 do we want to use? Do we want to use who? Do we want to use introduction timing, mental health, impact to families? Which ones do we want to use?
Just for speaking for myself, I would do the who is using the introduction timing and the impacts on families, because I'm just trying to think of a lot of the other stuff kind of comes after a person has been using a long time. And a lot of this other stuff is kind of on the front end. So I feel like it's kind of more like a prevention thing if you know this information first. You know, if they're getting introduced at 12, then you want to target that 12, you know, when kids turn 12 to target them, or before that date, and target the demographics that exist in those. And then I think it starts impacting family first, and then after that, you kind of, you know, we have people that done burned all their bridges because of the impacts on the family. So
absolutely,
that's what I would kind of be looking at on the forefronts.
Absolutely. Absolutely. Those are great, great 3. Great 3. I think we can move forward with those 3 if folks think that's a good move. So if we are talking about who's using introduction timing and kind of our impact to families, how would we go about identifying our age group? Would that be through a kind of a primary survey or primary kind of data collection point, being, are we going out and asking? Are we compiling that from other sources? How would we go about finding out what age groups are currently using what we've defined as illicit drugs? Is that a kind of a direct metric or indirect? Are we going to collect that from another way? How are we going to collect this age group for who's using?
I think it could be both direct and indirect. So direct, you could ask those already in the system. And then, or even, 18-year-olds, asking them their first age of use, but then those in, youth court or something like that. And then obviously it would be harder to ask them if they're 12. So then secondary for that, you could use, if you had access to health records, you know, obviously if they had given permission for that, but so that would be one example, I guess.
Yep. No, that's great. So we have health records. Let's say data collection. So we can ask use court health records, court data.
So, Bryan, we're coming up to the end of our time for the presentation this afternoon. I was wondering, for those on the line, is there, kind of putting you on the spot for a little bit, but is there a call to action or something that everyone participating in the breakout session should take back with them on building better data within their own communities?
I think really the call for action that I've seen, just an experience wise, is being able to have reliable data sources, and the need for them, right? To share data across across user bases. Because of where we stand right now with the pandemic, and how do we make wise choices with funding that is available to us, is how do we get data across users, from the public health sector to the technology sector to the economic development sector? How are we sharing data across those sectors? Has been really, to me, kind of a need and a call to action.
And one thing that I've just observed in the panel this afternoon, really, when we start examining data, it's asking these questions. As Bryan took us through his mind mapping questions, it's, you know, what is the answer, or what is the question we want to answer? And then constantly asking questions to get down into what we were going into, is then how do we find this data? But constantly asking questions, what else should be asked, that might be a direct link to, but as Bryan was mentioning, of trying to open up and break down those silos of, can we get data? Should we ask questions from a judicial side, from the economic development side, and really breaking down those silos. I think there was a question, Bryan, would it be possible to get a copy of this mind map? With participants?
Yeah, absolutely. Absolutely.
Awesome.